guys, so welcome again to Life Cycle 360, and in today's video I'm going to clear up what is wilderness first aid. I'm going to give you a little outline of what you can expect for when you want to do this course, because there's a lot of ambiguity when it comes to, okay, why do I need to do this, and I'm already first aid trained, right? So let's get to it. Well, let's look at this in terms of asking the question, what really is first aid? What is wilderness first aid? So to make it simple, wilderness first aid training will address the unique challenges and issues specific to becoming ill or injured. And the main thing you want to think about when it comes to wilderness first aid is being in a remote location. That's like the biggest challenge you're gonna face. You're gonna face once you're trained. You will be obviously training to be able to respond in remote locations, because wilderness first aid will be kind of geared towards persons who are in remote locations, like campers, hikers, people who work in the forested areas, hunters. Those persons would be who would need this type of training most. And even tour guides, I could add that in there too. So what's the difference, the main difference between a first aider and somebody who is wilderness trained and also, let's say, a wilderness first aider? The wilderness first aid training considers three things that's going to make the huge difference when it comes to being trained as a wilderness first aider or a normal first aider, basic first aider. First of all, we're going to look at having limited access to medical supplies. So that is one of the main things, because usually a first aider, when you're thinking about somebody who's a first aider, they'll have like their kit. If you're at home, if you're at work, you'll have like a emergency plan that your company may use. You'll have persons designated to respond and act. So everybody knows their role, and it's a very controlled environment. So that's one of the main things, being able to have access to medical supplies very, very quickly. You're also going to have exposure to outdoor elements, which when you're looking at wilderness first aid training, you have the elements such as extreme rain, extreme cold, extreme heat. And if we're looking at other parts of the world, you have persons who is going to have extreme cold, becoming hypothermic. So being able to have the understanding or the knowledge a little deeper where environmental emergencies are concerned, that is something the wilderness first aider would definitely have to have. You're also going to have extended response times for help coming to you, obviously, because you're going to be in a remote location. And I'm talking about maybe hours that you may have somebody coming to you. So being a wilderness first aider, if you look at it, it's a lot of planning that would need to be in effect, especially if you're venturing out to go. You must have some sort of system of how you're going to do things, and that's what this training is able to cover. So what is the role of a wilderness first aider? And I always say, anytime you have training and you've completed the training, you should be somebody that is going to step up in times of emergency, or at least be able to give some assistance. So when you're looking at a wilderness first aider, they are the ones who's going to provide help first. And that person, that wilderness first aider, will provide is a wilderness first aider provider is someone who is trained to deal with the immediate care or of a suddenly ill or injured person and manage the issues created by being in a remote setting. And we just spoke about the remote setting being these three things, where you have the lack of medical supplies, being exposed to the elements, and also the lack of ability to get something done quickly. So you're looking at time not being on your side. So those three things that person who is in that role needs to be able to work with to manage the person who has become suddenly ill or if they have become injured. That's what the role of a wilderness first aider is really all about. A decision to evacuate is going to be very necessary because unlike a basic first aider who is in a nice control setting, you need to make a decision as a wilderness first aider if we need to stay and treat this person or we try to get them out of where they are really quickly. So in a remote location, always assume that an ill or injured person's condition could deteriorate. So that is going to be something you have to decide. That's why your uh, understanding and your scope of what you're doing needs to be a little bit more than just a first aider because you need to make some serious decisions here. When in doubt, make immediate plans to evacuate and waiting to see if that person, the situation improves could be dangerous because you put in more pressure on yourself because you're limited in what you can do. And also you are now making the survivability of that person, you're now decreasing that survivability rate. So when in doubt, get out. So there are things that will not always go right, and being in a remote location, I mean, like Murphy's law is going to take place. What will go wrong, or what can go wrong, will go wrong. So it's always important to plan and have a steady head on you, and somebody who can take charge of it, right? So many things that you want to ask yourself and these, dealing with the situation and the persons that you may have to treat is what are the resources going to be available for myself? Another thing is the person able to walk safely? That will change the whole dynamic of how you're moving them and how you're carrying them if you have to, if they can't walk. Can the problems be managed in place? And we spoke about that. If you're in doubt or if you think the person just maybe has a sprained ankle, you can probably do some management on the scene of where they got the injury and take your time and try to get out, or if it's something worse, so can it be managed in place? How accessible is the current location? And I think once you know that you're going into a location that's going to limit your ability to have phone contact, going to limit your ability to, um, the terrain is kind of iffy, where you're not sure if you can make it safely back using that same road or access road. All those things is gonna make a huge change in how your ability to get that person out, evacuated, and how you manage them. Because time is what you would not have, and all these things is gonna affect that. You're also looking at what the weather conditions are going to be like that day. So always try to get from before you want to go and do a hike. What's the weather going to be like? Where we're heading, what you may be prepared for, and always think worst case scenario. So always be prepared for that. And what resources are available nearby. Sometimes you may have to, cut a piece of a branch from a tree to do some splinting. You have to kind of think on your foot when it comes to your wilderness first aid. Care and critical thinking is also important. So documentation is key, and that's something that you did not do or you would not have done in a basic first aid program. We will train you how to document your findings, and why it's so important is because documenting information about the emergency and the first aid care provided creates a reliable legal record of what happened. So you don't want to be, for some reason can't come out where you are, have a patient to deal with, and you just doing stuff on them and nobody's recording anything, so that when you do meet up help, or handing over the patient to the medical professional. You can, oh, I can't remember what I did. Yeah, I did. Yeah, I think I put something on it that day. I didn't splint it. She's diabetic. Everything is scattered. So documentation is key. And with the Wilderness First Aid Program, we are able to train you with the right procedures of how you can document the information that you have about your patient. So to be prepared for any legal or medical follow-up, the Wilderness First Aider must know how to write detailed notes, and that is preferably using a templated medical care report form. That's important. So that's something else you'll be exposed to, and you will be trained as to how to do that. So you also, let's say, remember we talk about if the patient or the person could walk. So you'll have to know a little bit more when it comes to how you're going to be moving and lifting the person to a safer place, or if you're going to get them ready for evacuation. So when it is necessary to move someone who is ill, injured, a wilderness first aider provider must know how to do it safely and effectively. When you did your basic first aid class, we spoke about emergency moves. This is not going to be an emergency move alone. It's going to be a move that will be taking them to a safer place or getting them ready for evacuation. So it's going to be a little bit more that you need to know how to do. The wilderness first aider, you should be able to correctly demonstrate these topics below. So if you're doing a one rescuer roll from the back side, from back to side, side to back, or face down to back, a 2 or 3 rescuer roll, side to back and face down, the body elevation or movement, the beam technique, and placing a person in the recovery position. Now all of these things you definitely will be doing, and you will be getting hands-on, and you'll be able to do these things with persons. You'll be able to designate, okay, you don't do this, you do this, pull here, hold here. So don't worry about if it's you alone. Being able to know what to do and designate or give directions is how you're going to get through that. So you're going to have where you're going to make some decisions that's going to be totally on you. And I like to call them judgment decisions, because there's no perfect scenario and there's no perfect step that you may have to do. Sometimes you have to do what you have to do, but you want to take into consideration all that you know before you just go and do it. So that's where it comes, and it's going to be called a judgment decision. So there are situations in which moving or repositioning someone is clearly necessary. If the person is in immediate danger, the position the person is in prevents effective assessment or treatment, and if the person's airway becomes blocked, the person needs to be moved to a short distance to be protected. Once you have these things in play, you need to make a decision and do what's best for the patient. When moving them is important because of their being in danger, you need to effectively assess them and treat them. Their airway becomes blocked. That is of utmost importance, because then, without an airway, nothing else can happen. And if they need to be protected because of where they are, it's probably going to cause them further harm. Right? So you'll decide that based on what is in front of you at that time. So your assessment and action. So you have your patient, you have to deal with them. Now you have to get an assessment done and you have to act. So using a combination of an initial and a focused assessment, this process identifies immediate threats to life, prioritizes treatments, and provides a detailed method for identifying less serious problems. And that's what you need to do. So your assessment is going to be a little more detailed and a little more, well, not a little more, it's much more detailed than you would have done as a basic first aider. You're going to add more stuff in there, more critical thinking. Before you can provide first aid care to the ill or injured person, you must identify the things that are really creating difficulty and harm. And that's why you must do things in a particular way that you don't miss anything that could come up and cause you to put a wrench into the engine and mash up everything that you were doing. we're going to be doing steps 1, 2, 3, to be able to get everything done on your patient. Complete care. So you can have a step-by-step assessment, and the initial assessment steps can be easily remembered using certain mnemonics. And once you're in EMS, mnemonics for everything. So the first one you're going to be doing is the mnemonic of ABCDE, and that is airway, breathing, circulation, deformities, and environment. When you're doing the course, if it seems confusing to you now, don't worry about it. We're going to go through it that everybody is clear on what you have to do and what each thing is about, so you know there's no confusion that's going to take place. The focus assessment is going to be in 3 parts. We talk about that. So you're going to have your hands-on physical exam, which is going to be DOTS, which is deformities, open wounds, tenderness, and swelling. But it's not going to be like what you did with the basic first aid. This time it's going to be much more detailed than what you did before. You also have these familiar with the sample history, and we're going to introduce to you certain vital signs that you can do to have a better idea of where your patient is at in terms of the stability of your patient. So certain vital signs you'll get to know how to do. We'll learn how to take your heart rate, your respirations, and also look back at that skin, that CTC, color temperature condition. So the last part of the step-by-step assessment is going to be where you have the mnemonic device of SOAP. SOAP being subjective, objective, assessment, and plan. So it's basically what you did with the patient. You're going to be documenting everything in that particular order. So subjective information is going to be, okay, I feel sick, I have a headache, I don't, I'm suffering with diabetes, high blood pressure. Objective information is going to be what you think is happening. Then you will do your assessment and your plan of what you did. So that's the order of how you're going to document your findings for the patient to cover you, and also to make sure that you have, okay, I did this, it's now this, something that you could use as a reference as well. So the mnemonic device SOAP can help you record and organize your documentation in a manner that will make it more understandable. So if possible, have another provider record the information while you perform your assessment, if it's possible. If it's not, you have to do it all on your own, right? And basically this is what it looks like as wilderness first aider. So you see why it's not that simple. And let me tell you, this course is, we at Lifecycle 360, we do it in 2.5 days. So it's not something you could do, it's not one day, because it's a lot of information, and also it's a lot of practical and hands-on skills that needs to be done. So you'll also be, what I didn't put here is we're going to talk about environmental emergencies, sudden illnesses, and mechanism of injuries, and nature of illnesses a little more than what you did before. And yeah, that is pretty much what it is. So if you're up for the challenge, and I recommend those who have been interested in it, I hope this video can help you become clear on what it is we going to cover as a wilderness first aider training program. Right, so if you have any questions, please contact us at lifecyclett@gmail.com, or you can visit our website at lifecycle360tt. Thanks for hanging in there with me. I got my camera to work, so now you're able to see me while I'm talking and doing this PowerPoint presentation for you. So thanks for viewing, guys, and remember, I put out videos on Tuesdays and Fridays, and today is kind of talking a little bit about the emergency medical services side, the first aid, the CPR. So this is what today is all about. Thanks for viewing, and don't forget to subscribe and share this video. We look forward to hearing from you. All right, guys, take care. See you soon.